Instagram.
Yay! Hey guys, I'm back. I'm Jen. I'm a nurse injector here at Night Plastic Surgery. We're gonna do a little Botox. This is my patient Jen. This is her first time doing Botox ever, so exciting. So we're just gonna kind of do a little bit of a rundown on Botox, where it's recommended, how many units, the pre and post instructions. If you have any questions, feel free to ask too. So, the three common areas that we treat is the glabella. So go ahead and frown for me. So right in there, that's called our glabella, which creates the 11s over time. So this is great for prevention and also correction of the 11s. Average dosing in that area is 20 to 30 units. Go ahead and raise for me as high as you can. We're also going to be treating her forehead. So over time, you start to get those horizontal lines on the forehead. We're going to try and prevent that from happening. So average dosing there is going to be 8 to 10 units. And then also the crow's feet. So smile real, yep. So hers are very mild. So we're still going to treat in that area. Our main goal there is to prevent. So with Botox, we recommend it every 3 to 4 months. There's really no downtime with Botox, which is great. So when she leaves here, she'll have a little bee sting where we inject her. So kind of right in this area up here and here. Goes down 20 minutes. All that we ask from you is no massaging it for 5 hours and just be gentle. 2 weeks, full results. So at 2 weeks, she'll see kind of what Botox is doing is it's injected into the muscle, therefore relaxing that muscle, not allowing those muscle movements. Now, with that being said, a lot of patients are like, am I going to look frozen? So there are some patients that want no movement. There's some patients that want some movement and just a little bit more relaxed look and appearance. That's why, given the patient's end desired result, we go off of how many units is recommended, and we might just decrease that a little bit so you can have a natural, no movement. Some movement. So it is very individualized for the patient, which is great. So we can definitely customize the dosage for patients. So we're gonna get started.
How long do you have to wait after Botox to get a facial?
So I always say after 5 hours. So even the next day, you'd be okay with getting a facial after Botox. Go ahead and relax back. Feels like a little bee sting, so very tolerable. She did numb 20 minutes prior to injections too. So I'm gonna have you go ahead and frown for me as hard as you can. Relax for me. So as you can tell, she's really comfortable. Another little pinch. Botox is great for all ages too. A lot of people ask, when should you start this? It is great for prevention. So even if those lines and wrinkles aren't present and you have the movement, it's good to start and prevent early before they're already formed. Now, if you have lines there, right now and they're already formed, it's not too late. We can always treat and correct. It just might take a few treatments to really get those lines softened. Raise for me as high as you can. Relax for me.
Are there any side effects
Nope.
of Botox?
No, some patients do report a little bit of headache afterwards, and a lot of patients just take Tylenol if they do get one, but that's about all that patients do report, or little pinpoint bruise is possible too. Easily covered up with makeup if you do get a bruise.
Will your forehead feel heavy?
No, so she will feel a little difference as far as raising her eyebrows, because what happens, the forehead's main job is in charge of raising and lowering those eyebrows. So when we relax that forehead muscle, it's actually not going to do its job like it would as far as raising as aggressively. So whenever she goes to raise, she might just get a little resistance. So, but there are some patients that we don't treat the forehead. If ultimately you want the lift from Botox, that's treating in between your eyebrows, which is your glabella, and then your crow's feet. That's going to lift your eyebrows. So the forehead, like I said previously, is in charge of raising and lowering. We don't want to go too aggressive. That's why we use 8 to 10 units in that area, because if we do too many units, we can actually drop those brows, which we do not want. So it's all about customizing it for the patient, looking at the anatomy of the patient. Every patient is different. That's why each patient that comes in, we do a consult, we talk, and we give our ultimate recommendation for that particular patient. So.
Does it have any permanent effects? Does it increase collagen?
I would not say it increases collagen. Filler, on the other hand, yes. This is Botox, so this is more of a muscle. So we're a muscle thing, so we're injecting into the muscle. So filler will stimulate your own collagen over time.
If someone has deeper, more permanent lines, how many units would you recommend for them?
So it's not about how deep the lines are necessarily, it's about how strong the muscles are that creating those deep etched in lines. So like I said, average for the in between the eyebrows is 20 to 30 units, and then 8 to 10 for the forehead, and 20 to 30 for those crow's feet. And now if you do have the etched in lines, sometimes it's going to soften with one treatment and not erase those lines. That is something to take into consideration. It's going to take a few treatments to really see those kind of soften more and more, about 3 to 4 treatments. So smile for me. We're going to treat our crow's feet now. Relax for me.
Someone said that they were told one time not to numb because it would lessen the effects of the Botox. Is this true? Question mark.
Not that we have ever found. We know majority of our patients, some don't because I mean, some people just, pick to numb, and everybody's pain tolerance is different. So majority of our patients, I'd say 50-50 numb, we've never had that issue.
Can you use at-home needle rollers or exfoliation while having Botox, or does it mess it up?
After 5 hours. So 5 hours after, you just don't want to put any hard, firm pressure. We're trained to inject the Botox into certain muscles to give you the best benefit and results. We don't want any hard, firm pressure and massaging the Botox in any muscle we don't want it to go into. So that is the main reason why not to put any hard, firm pressure or treat you.
Can you get your heart rate up after the procedure, and what about weightlifting?
So we say 5 hours you can work out.
Okay, and they said, can you get Botox for sweat reduction under the bust?
So on that area, you can do micro droplet Botox. We do that a lot of times on the face for pore size. We also do the Botox under hyperhidrosis, which we showed earlier, which helps diminish the sweating. So I would say yes, it would just be a micro droplet Botox.
Okay.
Okay, you're done. How was it?
Not painful at all, actually.
Yay.
Awesome.
Yeah.
Okay, so we are going to finish up this live, but we have a really quick turnaround. Jen is going to do filler. Where are you doing filler, Jen?
We're going to be doing the earlobes.
Okay, so stay tuned for earlobe filler. We will be right back.
Perfect. You're good.